Alrighty, it is 6 o'clock, so we will go ahead and get started here. So hello, good evening to everyone. We are so excited to have you joining us for today's FSU Chats. My name is Jared Logan. I use he, him, his pronouns, and I'm one of the assistant directors here in New Student and Family Programs. So before we get started, I do want to share a little bit of information about what are FSU Chats, who is New Student and Family Programs, and a little bit more about the programming that we do before we kick it over to University Health Services to share information with you all. So the purpose of these FSU chats are to inform families on important aspects of student life, provide support for families around topics that students sometimes experience, including challenges, and of course, answer questions with you all. Before we get into anything, we do want to start by saying congratulations. You and your student have finally made it. You are doing it. Going to college is not an easy feat whatsoever, and it's definitely something to be proud of. And also, we're glad that you are here. Families play a critical role in the student experience, and we're here to help you along the way. So a little bit more about New Student and Family Programs. New Student and Family Programs is committed to facilitating a welcoming and inclusive transition to Florida State for both students and families. Beyond new know orientation, New Student and Family Programs host signature programs like FSU Birthday, Ask a Knoll, and First Day Photos, in addition to the Family Connections e-newsletter, FSU Chats, Notes to Your Knoll, Coffee and Conversations, and many, many more other opportunities. So a little bit more about the Family Connections e-newsletter. This will keep you informed and connected throughout the year. Make sure that you signed up to receive the e-newsletters to learn more about upcoming events and important dates, ways to support your student, scholarships, leadership opportunities on campus, and even emergency notifications. You can sign up for these if you've not done so already using the link here on the PowerPoint you see. We'll also drop that link in the chat for you all to go ahead and sign up as well. We want to stay connected with you all. We want you to stay connected with us. You can stay connected with New Student and Family Programs by following us on all these social media platforms. They are all the same. They are FSU NSFP. Again, that's FSU NSFP. We post updates from the institution, updates about our programming, things you as a family member should know, as well as things your students should know pretty regularly. So please make sure you're staying connected with us and following us on these platforms. So earlier I mentioned a little bit more about the programs that we did. I want to go a little more in depth with you all. So for our FSU chats, we've had two already, this being our third one earlier this week. We spoke with Fraternity and Sorority Life, which is being recorded, and you will have access to that if on our social media platforms. Today we're talking to University Health Services, and then next week we'll be doing Ask the OLs, or what we sometimes call Ask the Experts. We'll do that in both English and in Spanish for family members and students to hear a little bit more from the student perspective and what your student and you could expect as you begin your time here at Florida State. Next is Ask a Knoll. So Ask a Knoll helps students find their classes on the first day of school. We ask students to stop by one of the 11 Ask a Knoll locations across campus to get directions to your next class, ask general questions about Florida State, or just to meet new people. Those locations happen on the first 2 days of class, so Monday, August 23rd and Tuesday, August 24th. Those are from 7:30 a.m. to 2 p.m. It gives students a chance to not only hear from New Student and Family Programs, but some of our other departments across campus that will be what we call adopting stops. So you can chat with some resources across campus. Along with Ask a Knoll, we also have First Day Photos. So First Day Photos commemorates a milestone in your student's FSU experience. We ask students they stop by Landis Green on August 23rd and the 24th from 9 to 2 p.m. For a photo with one of our iconic First Day signs. So think about those first day of school signs that you see a lot of our maybe students that are just entering kindergarten or preschool. We do the same thing for our incoming Knolls, which we're so excited to have. We have a multitude of signs for students to use. We just ask that students make sure they tag us on social media, which again is at FSU NSFP on social media with their picture, and they could be entered to win a chance to win a free t-shirt from our office. So we want to make sure that you all remind your students to do that. There are a multitude of programming that is happening for students beginning on August 16th to welcome them here to Florida State, called under the name of Welcome FSU. So, Welcome FSU is a series of events and programs that serve as the official welcome for all Florida State students. We have a lot in store during the first 2 weeks to help your student engage in all that Florida State has to offer. That does start on August 16th, so next Monday, and it will go through August 27th. There's a multitude of programming that takes place. We ask you and your student to make sure you check out the full schedule at welcome.fsu.edu. So with that being said, I'm going to pass it over to my colleague in University Health Services to share a little bit more about what's going on over there. And then after that, we will go into some Q&A and allow you all to ask us some questions as well.
All right, thank you so much, Jared. Hi, my name is Mary Kay Avant, and I am the Marketing and Outreach Coordinator for University Health Services. I am going to share my screen real quick, and we're going to go over. See if there it goes. So this is our home page, and I invite everyone to, if you have a moment, to check out our website. It is pretty comprehensive. We put a lot of information out there, and there are options down at the bottom. So if you don't see anything or you just have a question, you can always reach us there. So I always like to start out to showing people our website. It is super helpful. Let's see if we can get this to load. I do apologize for the delay. The weather is bad here in Tallahassee. I unfortunately had a tree go down in my front yard after some lightning, and it also took my power. So I'm on hotspot right now. So there we go. It's all set up. All right, so like I said, my name is Mary Kay. This is University Health Services, and we are the student's doctor's office away from home. We are much more than a clinical space. We do have classrooms and an auditorium within our building. So as the students come through and they need to charge their smart device or just take a load off in between classes that they may be in our building, they are more than welcome to do that. And I will start off with a little bit about being, going from dependent to independent as it relates to healthcare. Right now, as parents or caregivers, we are assisting with that navigation through the healthcare system that can be rather tricky at times. And so I know for my children, I will call and schedule their appointments and get them there on time. And that changes. So they're going from that dependent to independent care. So they're going to have to make those appointments on their own. So learning how to access our system, when to schedule an appointment, how to do it, getting there on time, because if you don't show up on time or at all, we do charge a no-show charge. So there are important things, just setting up that original appointment to begin with. So I encourage you, if you have the time while your student is home, to say, listen, call and schedule that doctor's appointment. Make sure whenever you get there, you present that insurance card, know your copay. If the provider gives you a prescription, know how to pick that up, maybe possibly have an additional copay. So maybe just have some of those conversations or actually walk through it if you have the opportunity. Some of the information that we do require, some of you may have already provided us with this, but the disclosure of personal health information is super important for us. It must be signed. If a student is under the age of 18, we definitely have to have this form and the next form on file. What this does is we're all protected by HIPAA, federal privacy laws. And should you call and want information about your student, unless you are listed on this form, we can't speak to you. Now that's if the child is 18 years of age or older. Now, if they're 18 years of age or younger, you still own them. And so you can still call and get that information. Now, if there's a medical emergency, we are always going to reach out and put you in a position to advocate for your student. So we may not be able to give you all of the information, but we will reach out. And keep in mind that students, I always like to tell families, they have the right to change and rescind this form at any time. So however they may fill this out with you, they may change that later, right? Because there's one or two things that they may not want the parents or family to know. And just if you keep an open line of communication, I find that you don't see a lot of those changes. So this next form is that consent to treat for minors. We do need that on file for those under the age of 18. If they're in an appointment and we don't have this on file, we would actually have to halt the visit, reach out to you, have this signed and send it in. So if you could have that sent in prior to, that would be most helpful. Our hours of operation are Monday through Friday. We have appointments available between 8 and 4, and we do have staff available until 5. Now, we are an appointment-based system, so you can call to schedule an appointment or stop by and make one face-to-face. Our telehealth service is now available. We've been utilizing this for the past year and a half. Students have seemed to really like that. They don't have to come to the health center. They can stay in their personal space and have a visit, but know that that is an option. One of the questions I get asked a lot are, what happens after hours if UHS is closed? And we do have an after hours system of care. We have various walk-in clinics, urgent care, and emergency rooms in the community. The one thing that I always like to make sure people check into is their insurance coverage, because I don't know what your insurance coverage is going to do if they go to patients first. There could be a copay and what that may look like. So I always like for folks to be prepared. We do have our Healthiest You. If you have the student insurance plan, you can call and use the Healthiest You. It's a 24-hour access telehealth service. But like I said, just be sure that you call your insurance provider. Just tell them, say, my student's going to be in Leon County, Tallahassee. What's that coverage look like for these different areas? We do have our patient portal. This is super helpful for students so that they don't have to call in to get their lab results. They can request medication refills. They can communicate by sending messages to us instead of waiting on hold, and they can view their current, future, and past appointments. And this can be enabled once they come in and schedule an appointment. They just have to ask and we'll get them set up. We do not have a pharmacy on site. There is a CVS located near campus on West Pensacola Street. However, right here, there's tons of pharmacies within the community, and we will send the prescription to wherever the student elects. I'm kind of going over some services that we offer. I'll go floor by floor. So on our first floor is our admission health requirements. So that's our compliance department. Many of you have probably already submitted immunization records and insurance to that department. We have our triage clinic that is staffed by registered nurses. So if a student is unsure if they actually need an appointment or maybe need some at-home care instructions, they can call in. One of our registered nurses will call them over the phone and they'll have that discussion. If there's an appointment warranted during that time, the nurse will set that appointment up. We have our priority clinic, which is our version of urgent care. We have our allergy clinic. Now, we don't do actual allergy testing, but if your student is currently receiving allergy shots with a provider at home, you can transfer that care and we will continue. We have our medical response unit, diagnostic imaging, where we can do x-rays, spirometry. We do not do CAT scans or MRIs, so we would have to send out a student out into the community for that. And we do help with that with the referral process. And then we have our Quest Diagnostics Lab. Now, this is another important piece with your insurance. Generally, insurance is contracted with either Quest or LabCorp. So if you'll find out which one your insurance is contracted with would be helpful, because if you are with LabCorp and your student comes to the Quest lab, Quest will be happy to do that order, but you will not be happy with that bill. So it's super important that you find that information out. On the second floor, we have our fitness and movement clinic, which is an extension of the Leach, and our physical therapy department. The third floor, we have Morgan Dental and Wellness Sport and Spine. Both of these are third-party vendors, so I can't speak to their billing, but they are housed within our building to make it more convenient for students to have a chiropractor and a full-service dental office on campus. The fourth floor is our Center for Health Advocacy and Wellness, our primary care clinic, Fast Track, and Travel Clinic. If a student is planning to study abroad, it's helpful to visit the travel clinic. That way they can be up to date with any immunizations or paperwork that they may need to make that trip. Our Fast Track clinic we use for things like strep testing, flu test, things that are kind of in and out real quick to leave room in our primary care for maybe lengthier appointments. On the 5th floor, we have our administrative offices, billing office, medical records, women's clinic, psychiatry, and our referrals department. We do have a full service women's clinic with the exception of OB. So should a student become pregnant while on campus, we'll have to refer out into the community. And then our referrals department, we have 2 referral coordinators. So if we are, a couple of times I have said, we'll send them out into the community. We don't just say best of luck. We do help you through, walk you through that process. And so our 2 referral coordinators will assist through the entire thing. If your student has any chronic conditions or special circumstances, it is helpful for us to know that in their chart ahead of time. So you can just reach out to us. Go ahead and send any pertinent information that's related to that, medical records. That way we can have it on file. If your student makes an appointment and comes in, we already have a head start there. Insurance and billing. So we are in network with a variety of different insurance plans, but we are currently out of network for AvMed, TRICARE Prime, and Medicaid. You can always call your insurance again and say, you know, my student's in Leon County. What coverage do I have? Is there a bridge of care coverage, something of that nature? But it is helpful for the student to know what their insurance covers. This is a current list of the in-network providers that we have, and I'll leave this up here for a second. Now, this presentation is on the website where I showed you in the beginning. You can go to this at any time. I leave this up there. You can refer back to it. You can send me a message, but just know that if I've gone through anything a little too quickly, you can always go back. So routine face-to-face visits with a general medical clinician are covered under the student health fee that you have paid. We do not take a copay at the time of the visit. We never want to deter a sick student from coming to see us. So that's taken care of. Now, billing comes into play. So if your student comes in and needs an X-ray or there's some sort of lab testing, that is when billing will occur. Now, the charges will bill the insurance, and whatever the insurance doesn't pay, we'll put on the student account. If you are interested in the student health plan, the United Healthcare insurance plan, it is a great insurance and has great coverage. This is a snapshot. This is the current rates for that. I do know that you can deduct it from financial aid, but you can feel free to reach out to our compliance department and they can speak more on the coverages for the United Healthcare plan. So UHS and COVID, things have been changing rapidly, as you know, and we still want to make sure that safety is top priority for us. And so our Stay Healthy FSU aims to remind all members of the FSU community to abide by recommended social distancing, face covering, and hygiene practices. So at UHS, we require you to wear a face covering and a patient care area. So if you come in the building and you have an appointment, once you go back there, you will have to wear a face covering. We do offer testing for those that are experiencing symptoms or concerns. FSU also has a testing facility, so we offer both places, so need not worry there. Our facility entry screening, right now we have measures to come in, not necessarily to come into the building anymore, but once you go to check in for your scheduled appointment, they'll ask a series of COVID related questions just for that, you know, safety for both the staff and the students. So some tips for the first year student. As I said in the beginning of the call, if you have the opportunity while they're at home to walk them through to schedule a doctor's appointment, that would be awesome. Bring your FSU ID and health insurance card with you. If you don't want to send the student off with the actual insurance card, a photocopy of the front and back will work. Just make sure we have a copy of the back because it's super important. It has some information on there that we need. Know your medical history, know family, your allergies and reactions, so that we can have that on file. And or if you're in that appointment, you're having that conversation with your provider. Understand your insurance coverages. Bring a feel better kit. So if there are medications that you prefer at home that you already use for over the counter care, bring that. Pack that little first aid kit just so that they have it on hand. A thermometer is always super helpful because a lot of times students will call and they will say, I had a fever, and you ask them what that temperature was, and they're like, well, I don't know, I don't own a thermometer. And in the entire 5 years that they're here, they don't like to allocate that $5 to buy one. So if you could send them with one, that would be great. And then just reminding them to practice, good hygiene. Make sure, that they're eating more than just did you eat, but what did you eat? Just make sure that they're eating more than ramen noodles. And to find us on social media, the first one is our website. The next two, we have Facebook, Instagram, and Twitter. And we are also on my FSU mobile. So I invite you to like us and share those different handles as we put information out there a lot, and you can contact us via those. And last but not least, some contact information for you to hold on to. Dr. Amy Magnuson is our director. Latricia Simmons is our assistant director of clinic operations, and then myself. And these are our email addresses, and you may reach out to us. Keep in mind that an email is not a secure form of communication. So just simply send us an email that says, I need to speak to you about my student, and one of us will be happy to get back to you. So I know I kind of went through that rather quickly. So we're going to pause now for any questions you may have, and we'll go from there.
Perfect. Thank you so much, Mary Kay. So for our families that are watching, please feel free to use the Q&A function at the bottom of your screen to ask Mary Kay some questions. While we wait for questions to come in, there's someone else on the call that I want to make sure you all are aware of. We do have one of our orientation leaders, Caroline, on the call with us. So Caroline, do you want to introduce yourself?
Yeah, thanks. Hey, y'all, my name is Caroline Owen, and I use she, her, hers pronouns. I'm a second year majoring in international affairs from Jacksonville, Florida. And on campus, I'm involved with the FSU Presidential Scholars.
Perfect. Thanks so much, Caroline. All right. So as I mentioned, please feel free to drop your questions in the Q&A. We are happy to answer those. We will, I'll moderate the questions out to Mary Kay as you all are asking them. So go ahead and feel free to drop some in there for us. So the first question I see we have is, what's the best piece of advice you would give new families to cover with students before sending them over or up to FSU?
Oh, I like that one. That's a good one. Take care of yourself. Your health is important. If you're not well, you're not going to do well academically. So, and if you need us, we are your doctor's office away from home. So don't be shy. Even if you don't know, if you think it's just too small, nothing's too small or too large, reach out to us and we can help guide. So just make sure you're utilizing your resources. And knowing, because UHS has so many services to offer. It's not just for those that aren't, that are sick. We have well appointments as well, physicals, and maybe just to talk to somebody. So I would say your health, tell that student that it is the most important thing.
Awesome. Thank you so much. So another question we have here, and you kind of mentioned the thermometer as one, but what are some other common things a family member should send with their student?
Band-aids, thermometer, maybe some over-the-counter cough medicine that they prefer that they use at home already. Maybe just go through your cabinet, your go-to at home, kind of simulate the same thing. So whatever you're using at home, send them, and it's, they're taking a little piece of home away, with them.
Awesome. Thank you so much. Let's see. So we have a question here in the chat, and it is, so this family member has Florida BC and BS. Is FSU, is the Office of Health Services considered an in-network provider or out?
So we are currently a provider for Blue Cross and Blue Shield. I know that with Blue Cross and Blue Shield, there are different plans underneath that umbrella. I would advise you to call in and speak to one of our insurance specialists, and you can give them your exact plan, and they can tell you what is covered. And those kind of I guess down here it says, what are the formulated rates with FSU? That would be the best thing to get a more accurate answer. But I do know that Blue Cross Blue Shield is accepted.
Perfect, thank you. So I see another question here. It's, do I need to have medical power of attorney for my student?
That I believe that's going to pretty much be a choice for you. Are you talking like to gain information or to make decisions? Is that something that's already in place?
Yeah, I think from how I understand the question, I would say it is really for just like making decisions for students.
I would say that if you already currently have that in place, you can certainly send that information up here. Or you can also reach out to me later, and myself and the clinical coordinator could reach out to you and have a little more of an in-depth conversation on that.
Awesome, thank you. So you had mentioned so Florida State itself does not have a pharmacy on campus, and there's one close. Can the doctors within the Florida State health system send pharmacy ask to the closest CVS or Walgreens?
They can send prescriptions to wherever the student elects.
Okay, perfect.
And
so
one thing I will add to that, I'm sorry, is a lot of times Publix has a list. I always like to tell the students, Publix has a list of free antibiotics. There's some medications there. So always, maybe just pass that information along too. If you're getting an antibiotic, let's check at Publix. Maybe that's, a free antibiotic that you can pick up. But there again, we will send that prescription wherever the student wants it to go.
Okay, awesome. We have another question here. It is, what happens if a roommate or a student's roommate in the residence halls gets COVID?
There is some information on our Return to Student Life 2021 website, and same as our UHS COVID website. Because it is so fluid, I'm going to direct you to those websites to find that information. Like I said, it's fluid and it changes. So I couldn't give you a definitive answer right now as to what that plan is. I apologize. But there are resources out there that we can get to you.
Absolutely. Thank you so much. So we have a question here, and it's related to class. So I'm hope maybe you can answer some of these pieces. Will a student need to provide a doctor's note or some sort to professors if they were to get COVID, or if they just get sick in general? Do you all provide doctor's notes to students for them to share with their faculty?
Our medical note policy is on our website, but yes, a student would have to be seen in the clinic. So a lot of times, I'll tell you, scenario-based, we'll have students who did not show up to class, but they also did not come to us. So we cannot provide a note unless you are seen within the clinic. So you would have to have an appointment that day with one of our providers to get a note. Does that answer that?
Yeah. I think that was great. No, you're totally fine. So as far as when it comes to referral services, would you all also be the folks that refer students out if they need counseling support, or is that another location on campus?
We work very closely with counseling and psychological services. So students most definitely can come to UHS, and that can be a starting point. And then from there, if there needs to be a referral, we definitely work in tandem with CPS and can get their care transferred over, and likewise. So.
So we have another question here is, can a student use an FSU Health Services doctor as their primary care doctor if they wanted to?
Yes. Yes, they may.
Oh, here's a great question. I think this is still related to our COVID question. So can my student get the vaccination or get COVID-19 vaccines on campus still?
Absolutely. Yep. At vaccine.fsu.edu. And there's a complete schedule on there that tells you when they're available.
Awesome. So again, folks, please feel free to send in your questions. We're happy to answer them. Just keep sending those in. Another question. Oh, here's a great one. Are health services open on school breaks?
We are, with the exception of the winter break. So we will be closed from the 24th and we will not return until I believe that the Monday after New Year's. The campus, the entire campus is closed. But outside of that spring break, we are open. UHS is here.
Great. So another question kind of related to continue with vaccinations, but just think about general vaccinations. So the first part of this question is, can my student get their immunizations to go abroad with University Health Services, and or can they also get things like the flu shot as well?
Yes, so immunizations, you most definitely can to go abroad. And that's where you want to make an appointment with our travel clinic, because they are going to check out the location in which you are traveling to. They're going to match that up with what you need. So yes, you definitely can do that. Flu shots. I just so happen, flu campaign is something that I manage every year. So yes, flu shots are available to the students in the fall. That's generally when we kick off our flu campaign, and we will post on website and on social media, and various campus partners will share that information out as to when they will be available and where. And the flu shots are at no cost to the student.
That's really great. So here's another question. What happens if a student living on campus contracts COVID-19?
If a student living on campus contracts COVID-19.
Mm-hmm.
So they would need to notify housing, and then housing is going to direct them from there. I am sure they'll either go through testing, whether it be at the Tucker Civic Center or at UHS. UHS, if you come into UHS, the clinicians and the nurses are going to direct you as to what you do from there.
And one thing that I'll add in, hi everyone, Allison Leach Hughes. I serve as the Director of New Student and Family Programs. We do have a SAFER team that works to notify students and make sure that they are aware if they've come in contact with someone that has tested positive with COVID-19 or has been exposed to someone with COVID-19, and they do a really good job of working through and answering any questions for your student if they do contract that, or if they're potentially exposed to COVID-19. So please know we have folks on the back end definitely doing some of that work and making sure that your students are supported throughout that process. Specifically for students living in university housing, they will be isolating in their own residence hall room. But if there are any questions or concerns related to that or access to that, I definitely encourage reaching out to housing directly, because we are working on some different support plans for students that maybe might not have access to something like that available. So I do just want to make sure to mention that housing at fsu.edu is the email address, and we'll also make sure to drop the phone number in there for any of our folks living on campus in university housing. Another nice feature that I know has been introduced this year based on success in last year is this flex style teaching. So maybe if your student or a roommate has been exposed to COVID-19, oftentimes professors will work with students to make up that work, and they don't actually need a note to miss any classes, because I know that's always a big concern, and Mary Kay already got that question too. So I just wanted to mention that to encourage your students to be proactive, and if they are exposed or do contract COVID-19, just making sure that they're communicative with the process, and making sure that they respond to those SAFER team messages that they'll receive as well.
Perfect. Thank you so much, Allison. So we've kind of talked a lot about, students living on campus and using university health services. Mary Kate, can off-campus students also use university health services? And if so, is there a different process that they need to go through?
Now, as long as you are a Florida State University student, you can use university health services. There's no different process. We treat everybody the same, whether you live on campus or off.
Awesome. Thank you so much. So another question that we just in general where is University Health Services located on campus? Is it close to where the academic side, or is it close to maybe where some of the residence halls are in general?
So we are pretty central. We are over, let me try and think. We're pretty central. We're close to the Einsteins. I was going to say Starbucks, but it is now the Einsteins, just behind HCB. We are close to several of the residence halls there and the practice field. So we can actually see campus rec as well from our building. So we're pretty centrally located.
So another question we have here is, what if a student has a medical emergency? Can you tell us a little bit more about what local hospital options there are near campus?
So if they have a medical emergency while UHS is open, they can definitely call us. We have our medical responders, and if a student is on campus, now this only applies if they're on campus, if it's a medical emergency, our medical response unit will go out and pick that student up and bring them to University Health Services. If it's an emergency that we can't handle inside of UHS, we will then arrange for that student to be transported to the emergency room. We do have 2 emergency rooms here in Tallahassee. We have Capital Regional Medical Center and we have Tallahassee Memorial Hospital. But like I said, medical responders will respond to that student, bring them back. If we take care of the situation and they need to go back to their residence hall on campus, they will then take them back. Our medical responders, though, cannot go off campus. If it's a medical emergency for a student who lives off campus, I would recommend them going to one of the, or they can certainly come to us if we're open, but if it's a true emergency, you can definitely go to one of the hospitals.
Awesome, thank you. So Mary Kay, we talked about the different things, I guess, medical things that University Health Services does, but are there other maybe like programs or initiatives that the department itself does for students, maybe that be like events or sessions that students could attend?
Yeah, so our Center for Health Advocacy and Wellness, they do a lot of prevention programming. And so sexual health, nutrition, our alcohol and tobacco and other drug department. So there's a lot of things, programming, ways to get involved. Maybe they just want to speak to somebody as it relates to nutrition to get some information. They can definitely do that. We do have other ways to get involved. We have our Stay Healthy Ambassador program that assist with all of our COVID initiatives. So being, remaining socially distant, and there's various things that they can get involved with there, helping out at football games and different sporting events. We also have our health committee. So we have a team of students who serve as the liaison between the student body and the leadership team at University Health Services, because there's a lot of things that the students want or need as it relates to their health care and changes that they would like to make. And we want to hear that. So we have that committee that students can join, and they can be out there, the feet on the ground, and liaise between their peers to us, and we can see what we can do about making those changes. So there's ways to get involved, and then we do have programs available that just aren't coming in because you have a sore throat.
Awesome, thank you so much. So we have a question here in the chat, and it's really centered around, what items, if any items, do you provide students to support their sexual health?
Oh, that's a good one, because I did miss that just now with Chaw. So we do provide condoms. Students can come right into the building. There's even places throughout our building where you can just come up and grab them as you need. And then our women's clinic, like I said, they're a full service women's clinic. So if it's birth control, that somebody is looking for, we have those options as well.
Thank you. So you talked a little bit about the allergy clinic. What if a student has allergies? Can the allergy clinic or University Health Services in general store things for students?
Yes. So if a student is currently receiving allergy shots at home, you can transfer that care over. You would reach out to our allergy nurse and you would transfer. There's some forms that you would have to fill out, and the shipment of that medication can be received by us. And then we will continue that plan that their provider at home has already put in place.
Awesome, thank you. So we talked about health insurance and students that bring it in, but does the university itself offer student health insurance?
Yes, that is the Student Resources Plan. There's a website that you can go to get a little bit more information on that. That's student insurance at fsu.edu. And then we do have a department, our compliance department, that could answer more questions. In that presentation, I showed a snapshot and it shows the fees for that if you want to buy it for the year or half the year. It is a great policy. I will tell you that we have a lot of students who currently have insurance but choose to have that while they're here. It does follow them if they go on a spring break vacation somewhere. They're not isolated to just Leon County. So it's going to follow them. And it is a United Healthcare policy, which they do a pretty good job.
Awesome, thank you.
One thing I'll add in really quick with that is just a reminder that your students will need to verify their health insurance multiple times throughout their FSU experience. And so they might have a hold that's placed on their account around course registration windows and so on and so forth. And usually it's there a while in advance, and maybe students overlook that. So just a good reminder to encourage your student, especially around course registration times, that if they do need to do that health insurance verification, they get that done early so it doesn't prevent any issues registering.
Perfect, thank you, Allison. So Mary Kay, as we're beginning to wrap up, and folks, please feel free to continue to ask questions, but as we're kind of wrapping up our time together, I want to ask you and also ask Caroline, what would you say is a piece of advice you would offer to students around their health as they're coming to Florida State?
Caroline, do you want to go first as a student?
Sure. So in terms of like staying healthy, I think one of the most important things is just balancing your time, knowing when you're becoming too stressed, when things are too much, knowing when you might be beginning to feel bad, and being able to kind of sense that as like the days continue. And so eating your balanced meals with seminal dining is a great option. University Health Services, you can talk to them really easily. Like we've been saying the entire time, it's really easy to get in contact with them if you have any issue whatsoever. If you're just concerned because you just feel off, it's really easy to talk to them. But also you can go to the Leach and work out with campus recreation, and that can help your physical health. In terms of mental health, we can work with counseling and psychological services, and they're an awesome resource if you want to talk to a counselor or a therapist specifically. So there are a lot of options and a lot of different ways to remain healthy on campus. And University Health Services is just kind of the director to a lot of these smaller branches that you can deal with.
Yeah, so I agree with what Caroline said. It's about that balance. It's about coming and finding and recognizing maybe when you need to slow down or when you need to ask for help, because that's what we're here for. So like I said earlier, it's not too big, it's not too small. You just have to recognize, okay, I probably need to step back a little bit. Is it that I need more sleep? Do I need, do I need to incorporate a little exercise? Do I need that whole school life balance? It's finding that because we find that whenever you're stressed, your body takes a toll on your body. So listening to your body, those are the things that I would suggest as it relates to your healthcare and coming on campus. Staying well. We have a saying in our building, and it's be well, do well. So.
Perfect. And also, Allison, I didn't ask you if you had any thoughts. Allison, do you have any advice or tips that you would share?
I do. Just like two. One is encouraging your student to get some sleep. I know it sounds very trivial, but just knowing that students need it, we all need it, and there's so much value in getting that. And there's some really good resources through CHA, and I just dropped the link in the chat, where they talk through the importance of sleep and other areas of wellness, but specifically a sleep tracker and things like that. Again, I know it sounds silly and your students are probably going to roll their eyes at you, but I can't tell you how many conversations we have within the first year with students where they're like, I just don't get enough sleep. And we're like, we know. We see you out and about on campus all the time. And the other piece is Alcohol EDU is something that is a resource for your students, and they should be receiving information soon about Alcohol EDU and making smart decisions regarding alcohol throughout not just their first year, but really throughout their college experience and into their professional careers as well. And so that is an assessment that's really going to help them understand how to track and do responsible usage of alcohol. And so I definitely encourage you to have a conversation with your student about that. And then just a second, I'll add some common talking points and challenges to the chat that you can touch base with your student, and just make sure you have some important conversations about things that they may experience in their first year. So just some things that'll hopefully get them started. I'm a firm believer in setting expectations from the beginning, because if you and your student know what to expect, then hopefully you can exceed the expectations that have been set, and nobody is disappointed in the end, and it leads to hopefully less complicated conversations later on. So I'll definitely include that there as well.
I love that,
Perfect.
Allison. I like to tell parents to keep that open line of communication with your student. I find often that, when they come in, they, they want to call their parent. They're like, here, just tell, here, talk to my mom, talk to my dad. But if you're having those conversations and keeping that open with them, they're going to want, they're in that appointment and they're a little nervous, so that they're wanting to call home to get a little bit of help.
Perfect. And I actually have my own piece of advice that Caroline just made me think about. Caroline talks a lot about Leach, our recreation center for students to have fitness, but which involves obviously thinking about themselves. I would also say the first couple weeks of college are stressful and there's a lot going on. Tell your students to take time for themselves. Tell them that it's okay. They're like, as much as there's events going on, and please know, as a professional, I want them to go to all those things and be excited and be connected to campus. Sometimes stepping away and like spending some time in your room or taking a nice little nap. That was one of the best things that ever happened to me in college, was taking a nap or just taking some time away is so important for them. We're thinking about their overall health and their well-being. So like taking some time, step away. The friends will be there. You can hang out with them at some point, but like hang out with yourself too. You're fun. You're exciting. So remind your students to do that as well. So with that being said, I just want to say thank you to Mary Kay, Caroline, Allison. Thank you so much for being with us today, answering questions, dropping things in the chat, answering our family's questions throughout the time. I just want to have another quick reminder. Please make sure, if you've not done so already, please make sure you have signed up to receive our family e-news, our Family Connections e-newsletter, where we'll provide more information to you, things that are going on with the institution. We'll provide some insight and things as well, ways you can have conversations with your students as they begin their transition here to Florida State, but also as you begin your own transition as a family member of a Knoll. Again, make sure you check out the links that we share with you, whether it be about Welcome FSU, any programs that New Student Family Programs is putting on, or also any of the things that Mary Kay may have mentioned that happens within University Health Services, as well as what we call CHA. Please make sure you check out those things. But with that being said, if you do have questions, please feel free to reach out to Mary Kay. Feel free to reach out to University Health Services in general, but of course, reach out to New Student and Family Programs is what we're here to do. We're here to provide you with resources and information that you need to be successful in supporting yourself, but also your students. Again, enjoy the rest of your evening and thank you so much. Bye, everyone.